Good morning, everyone. My name is Rick Noda. I am the founder of T3 Body and your host here for T3 Talks, where we tighten, tactical, and transition. I'm here in beautiful Encinitas, California, with a good friend of mine, Dr. Sexton. Now, I will tell you guys that author, good friend. You're married. You just came back from Africa. He has such a spectacular life, you guys. I can't do him any justice. Dr. Sexton, will you introduce yourself and tell everybody what a great doctor you are?
Well, no. I think that's probably a little bit more credit than I deserve, but it is great to be here. Rick and I have been friends since I started my own practice here in Encinitas about 10 years ago. And my background in training is I've been trained in emergency medicine and family medicine. And my private practice is a family medicine office where we treat essentially anybody for anything. We also help people with problems with addiction, in trying to get off pain medicines and trying to get them in control of their lives and raise them up. So, this is really what my practice has been about. And Rick and I have had a chance to work together with a lot of patients in helping them recover from things such as injury, coming up in situations where they've been having problems with things like depression and anxiety, and how do we use things like exercise to help them overcome those problems. So this has been sort of a commonality between Rick and I, and I've loved talking to him about all of the progress that he's made with some of his clients. It's a really good situation.
Well, it's Doc. When we were here, in the video before, I told him it was brick and mortars. I mean, literally, it was shelled out. There was nothing here, and then Doc says, "Hey, in about 45 days, we're going to have everything." And what you see here is, like I talked in the other video, is not your typical office. You and I really got me to the mindset of a luxurious environment, allowing everybody to kind of talk over coffee, and by the way, this product placement, we're sponsored by Panic & Coffee House, you guys. There it is.
I didn't get any freaking coffee, man. What the heck?
But no, so that's the thing, Doc, is we really enhance that coffee-like experience. And in my practice, I think the highest compliment you can ever do is duplication. So when people come to my facility, they really in a relaxed environment and things like that. Now, how did you think of that? Like your background, and I'll tell everyone, he worked for somewhere where, it starts with a K and has a P in it, all right? So we're not going to necessarily throw that out there. But tell them a little bit about that experience and where it led us to have this beautiful, relaxed environment.
When I worked for a large HMO organization prior to starting my practice, we had the advantage of having a great computer system in that hospital that allowed me to communicate a lot with the patients. And their standardized format of how these large HMOs treat patients is trying to essentially increase the number of patient appointments that they have without giving as much personal attention.
Correct.
Well, my approach back at that time was to try and take a look at the patients that might be scheduled to see me for problems that really didn't need to see a doctor for them or could be dealt with through a simple email communication. And by doing that, I was able to cut down the number of patients that I would see, but spend more time with the patients that actually needed that care. That time that you can give patients in that circumstance can go towards setting up a relationship such that they trust you a little bit more, such that they actually reveal things about their personal life, the stresses that are going on, and how that impacts their health. So we would uncover lots of things that they might only uncover with their psychologist, their psychiatrist, things like that. Furthermore, we could take extra time with those patients to teach them how they could manage these problems on their own. So many patients would come to me and say, "Doc, I've got this cold that's been lasting for 5 days and I need to take these antibiotics." There are so many things wrong about that situation that, I'd say, okay, let's back up a little bit. Let's talk about the symptoms you're having. Understand that whenever you have a cold, the reason that you're having those symptoms is not because this virus is making all sorts of poisons in your body or anything like that. Rather, the virus is just taking vacation inside your bloodstream, and your body is sending a bunch of inflammatory cells to the places that it's able to in order to try and combat that. And if we can sort of minimize that inflammation, we can minimize the symptoms of your cold, and we can actually help get these people over the colds a little bit more quickly. So by taking a little bit of time and teaching them I'll call it a simple understanding of these things, you can give them the education such that they are taking care of more of those simple problems on their own with more healthy solutions, not looking to things like antibiotics for things that are not necessary. and you can teach them to be more proactive towards those health-related issues. So
that's
the excitement.
There it is, you guys. Now, proactive. Now, we talk about all the time in the military, we talked about the 7 P's. I said it again. There it is. Proper prior planning prevents piss poor performance.
And he used to say this stuff even when he was working for me.
Yes, it was. Same old, same old. It hasn't stopped. But the cool thing about that is because of that proactive approach and teaching patients, we really get them to educate them on the 4 parts. Now, referring to another doctor, Dr. Amen, that talks about the 4 stages of like mental illness: the biological, psychological, social, and that spiritual. Dr. Sexton embodies that because, again, if you just throw someone some antibiotics, again, they grow resistance to those antibiotics, and they didn't learn anything. They just learn to call the doctor whenever they need. This way, they help with, again, have it be an ankle twist or a congestion in the lungs, how to deal with inflammation. And I love that.
It's a challenging thing sometimes to help patients do this, because whenever they are feeling poorly, whether it is from a cold or whether it's from an injury, everybody wants that instant gratification of relief. They all want to feel like they have gotten better. And, it's sometimes difficult to approach a patient and say, hey, I know that you have gotten better when some other urgent care doctor has given you a Z-Pack for your cold, but in truth, you took that Z-Pack for 5 days. Your cold was probably going to get better in 5 days anyway, and he just wanted you to feel like you were getting your money's worth out of something like that.
Exactly.
So, it's a little bit of an illusion that sometimes we medical professionals give into the easy thing. It is much easier to prescribe than to describe, that it's much easier to give someone a medication than an education. And what we try and do in my clinic is take the time to understand the patients and help them to understand themselves.
And that ecosystem works hand in hand, because now that they go to the physical therapist, or if they need physical therapy, if they go to the endocrinologist in this, now you're quarterbacking that, and you can actually give good information. And that was something that I loved about working here, is that there's 2 ways that you can be in a primary care. You can be a crossing guard, which currently you go to this orthopedics, you go here. But me and Doc really worked on individuals, and we were able to say, okay, we got you to this point, now go see the specialist. And I think that was a really good part. And I like to say that it was a mix of Eastern and Western medicine, because that's the philosophy that you see in Eastern practices. It's not holistic, but what we did something that Western medicine doesn't do. Take the time, and that time we use to teach. So I got to tell you, you guys, this week, Doctors and I are going to talk about the truth about inflammation. We're going to have some story time, and then we're going to talk about one of the cool things that he has right here that helps kind of help you get over some of those little problem areas, you guys. So when I say our motivation inspires you to be better, stay tuned for my Dr. Sexton and I. T3 Body, you guys, is a company and a fitness company that really talks about the complete athlete. When I talk about our motivation inspires you to be better, all right, as a non-for-profit that supports military veterans that suffer from mental health issues, I really enjoy the support you guys are giving me here on YouTube. But again, I am seeking clients on my T3 Body. So if you go ahead and take a look at my website, understand that the intimacy of getting to know you starts with just 30 minutes motivation. So you go on there, you sign up for one of those, you get a one-on-one remote talk with me just like this. Then I encourage you to go and look at one of my training plans, download a 4 to 8 week training plan, and really kind of just test your body, test yourself, and just really start to get yourself ready to then do the next thing, is where you get 4 or 5 of your friends together and dare yourself to be better, where there you have a little bit more of my information along with my training plan. You get some remote sessions with me regardless of where you're at. You notice if you're watching me on YouTube right now, you could see you can hear my voice, and I can train you, all right? And that 45-day dare is a great way to just see and challenge yourself to really do the final thing, is become a member. Being a member with me is a commitment, and it's made for just an elite amount of people. So when I talk about membership here, I really talk about a really elite group of individuals who really understand our core values of God, country, family, and really live by and have really adopted where our motivation inspires them to be better. So I wanted to touch on that, you guys, and really use that so that individuals like yourself who are getting better and inspiring others that understand that, you know what, we do need your support to keep everything going.